Hello, I'm Lisa Martin from HORIBA Veterinary, part of HORIBA Medical. I'm delighted to welcome you to this continuing professional development webinar, the next in our series covering a wide range of diagnostic topics. Our previous content can be found on the HORIBA website in the support section. The address for this should be displayed on your screen now. I'd like to introduce you to our speaker, to tell you a little bit about what to expect from the webinar today, and a little bit about HORIBA Veterinary. We're very pleased to be working with Sam Taylor, a busy practicing veterinary surgeon with a passion for feline medicine. Sam graduated from the RVC and completed internships in private referral practice before starting a Feline Advisory Bureau residency at Bristol University. She's been awarded the RCVS certificate in small animal medicine and the European Diploma in Veterinary Internal Medicine. Sam went on to become an RCVS recognised specialist in feline medicine and in 2019 was made a Fellow of the Royal College of Veterinary Surgeons. She is the International Society of Feline Medicine's Specialist Veterinary Consultant and works in education for Linnaeus. Sam has published on many areas. She's currently working on FIP and has set up and runs with other feline specialists the FIP advice line, which has helped over 600 vets use the newly available FIP treatments. FIP is a viral disease of cats that occurs throughout the world, and anyone who has faced a suspected case will know it's a complex and challenging disease to diagnose. Sadly, it was previously fatal in most patients. However, in the last 3 years, significant developments have occurred in treatment, and now many cases can be cured. These developments are great news for cats, their owners and the people who look after them. We'd all prefer a positive outcome. But the treatment can be prolonged and expensive, and because of this we must give consideration to the owner's budget, both for investigations and for preserving funds for therapy. Sam will talk us through the steps in making a confident diagnosis of FIP, the complexities of treatment with antivirals, patient monitoring, adverse effects and prognosis. An open Q&A will follow her presentation. HORIBA Veterinary are a well-established provider of laboratory diagnostic equipment. We work with veterinary reference laboratories, educational settings and general and referral practices. Our product range includes handheld meters covering single parameter tests, high capacity automated laboratory systems and the first fully integrated in-house PCR testing system. Here's a brief introduction. Our LaquaTwin handheld meter range works in seconds, including metabolites and electrolytes, and can be used patient-side. Our unique ionised calcium meter is especially useful for use in dairy cattle. Using just a drop of blood, this test can enable early intervention for better post-parturition recovery, milk production, and even future fertility. HORIBA offer 2 systems for clinical chemistry. Our Pentra PC400 is a high throughput instrument suitable for larger practices and is used in reference laboratories. It features capacity for 55 onboard assays for day-to-day testing and beyond, including electrolytes, inflammatory markers and acute phase proteins. Users can run a single parameter or create their own fully bespoke profiles. The 120 VP analyzer works in minutes on whole blood samples with 15 predefined panels for comprehensive or targeted testing in all species. Up to 24 parameters are simultaneously reported, and specific concerns can be assessed and monitored, including diabetes, electrolyte balance, liver and kidney function, with additional profiles for coagulation and inflammation, including canine CRP and feline SAA. The Pocket Central PCR Analyzer is a fast, compact, benchtop instrument. All steps of the PCR process are fully automated, do not require any additional specialist equipment, and can be run by any trained member of the practice team 24 hours a day. Results are available in just 85 minutes. No waiting for a lab pickup or for those results to be sent through, speeding up diagnosis times and aiding patient management. The Pocket Central test range includes over 190 assays for bacteria, viruses, parasites and protozoa. covering small animal, farm, equine, poultry and agriculture work. The Pocket Central enables fast and easy PCR testing in any practice. Should you have any questions for Sam or for the HORIBA team, please pop your query into the Q&A box on your screen and we will cover as much as possible at the end of the webinar. If you would like a certificate of attendance, please provide your details via the Q&A box. Include your name as you would like it shown on the certificate and your email address, and we will send it on within the next few days. You will also have our contact details at the end of the webinar for any further queries or if you are watching back. The event recording will shortly be available to view on the HORIBA website, and you'll be sent details of how to access it for you or for any colleagues. So now I'd like to hand over to Sam Taylor to talk about feline infectious peritonitis, not so new treatments for FIP. What have we learned?
Hi everybody, it's fantastic to be with you this evening, and thank you very much for joining us, and thank you for HORIBA for asking me to speak on this, one of my favourite, well perhaps currently my favourite topic. I think you'll pick up through this talk why I'm so mad about this disease. It's not common in particularly the field that I work in, which is internal medicine, that we discover a treatment that changes the outcome quite so dramatically. I don't know how many of you listening have dealt with FIP cats, but I, little grey haired now, so over the years have dealt with quite a lot of FIP positive or FIP cats that we've made a diagnosis in, and we have euthanized them all. To be horribly blunt, we have, and now we have an opportunity to treat them, which is just, you know, so fantastic. We're really excited to be able to do that, and so I'm going to bore you to death tonight. I hope you've got a cup of tea or a glass of wine, and we'll talk about both diagnosis and treatment. Now, so in this talk, I could, and I said this to Lisa earlier, I could spend hours talking to you just about diagnosis, and I could spend hours talking to you just about treatment. So I have had to be strict with myself and cut down the talk and make sure it fits in the time, so that you don't all stay until midnight while we talk about these diseases. So we're going to have just like a brief revision of clinical signs, and as Lisa said in her introduction, the conversation has really changed, because we need to be confident enough in our diagnosis to use the new drugs, but we equally don't need to use up all the funds in making that diagnosis so that we can't treat it. And that's a really different situation from where we were before. And then I'm going to update you on where we are with treatments right now, because we have learned so much in the last couple of years, not just through our FIP advice email, but through treating cases myself. But we're also collecting data from around the world on the novel treatments. And that's taught me so much about the pitfalls and the doses and things like this. So I'm just going to try and share that with you guys. So whether you've treated a case or you haven't yet had the chance to treat a case, I hope it will be useful to you, because sadly, it is something that if we work in small animal first opinion practice, that we're going to see. I want to weave through this talk a case, because I know that is something that I always enjoy, is the practical aspects of this type of talk. So we're going to tell you about Hudson. Now, Hudson is very cute. I think you'll agree. He is a 6-month-old male, now neutered, British Shorthair. And British Shorthairs are a breed that have become, quite a lot more, I don't want to say popular, because they've always been quite popular, but they actually, when you look at the data, have overtaken Bengals and things as far as most owned types of purebred cats, particularly in the UK. So you're going to see a lot of them, and unfortunately we do see a lot of them in our data on FIP. So they're a lovely cat, but now when I see them, I feel a bit anxious, because I've seen how many we have in our study that are British Shorthairs. He's a previously healthy kitten owned by a lovely lady, very dedicated, and he was neutered a week or so ago, and he was fine for a day or so. And then a couple of days later, he became lethargic, he was pyrexic, and she noticed that his meow was different, which I think you and I would put down to perhaps being intubated for the procedure, but he's not eating either, which is very out of character. It's very easy in this situation to kind of put that down to something to do with the anesthesia, something to do with the castration, but obviously we've got to have an open mind. Now, one thing I just want to point out about this picture, which I love this picture. This is kind of pre-treatment, and you'll see a real change in this cat between pre-treatment and post-treatment. And I'm slightly giving away what his diagnosis might be by including him in this talk, aren't I? But what I want to show you is a sick cat and a painful cat. And I don't know if you're all familiar with a thing called the Grimace scale. And the Grimace scale, if you're not familiar with it, just Google it, and there's an app as well, and they've got a really nice website. It talks about feline facial expressions and how they can indicate the cat is in pain, and I think also indicates kind of sickness and illness too. So what you can see in Hudson is that his ears are almost, that you can almost draw a line across the top of his head, can't you? His ears are slightly rotated laterally and backwards. And the other thing that we can see is that his muzzle looks quite stiff. He looks quite tense, and his whiskers are coming out straight laterally rather than kind of going outwards and downwards. And you're probably thinking, why are you telling me about this in an FIP talk? But it's just to show you that probably some of these cats are quite painful. And when he came in, we just immediately thought that he looked painful and unwell. So Hudson had some investigations before he came to me. I'm very fortunate working in referral practice, so we often have a bit of history, you know, and everyone in first opinion doing a great job investigating these cases. So on exam, he was pyrexic, as I mentioned, and he had a palpable abdominal mass, which was obviously quite surprising. Had some bloods done, and he had a mild anemia, and he had a total bilirubin that was elevated. He didn't look clinically jaundiced, but his bilirubin was up. And the vets had done an abdominal ultrasound and sampled this mass. There was a tiny bit of fluid, but too little to sample. And they'd sampled it, and it had come back as sort of degenerate neutrophils, no bacteria, but aspiration of necrotic material. So one of these results that we hate getting because it doesn't get you that much closer to a diagnosis. So I'm going to pause his investigation here. You're probably thinking yourself, what would I do next? But we're going to pause it, and we're going to come back to him. Because what I want to talk to you about is how to make a confident diagnosis of FIP, because that is just not always easy. And actually, what I will also tell you, it's not always possible. So lots of cases will be treated with these drugs without a definitive diagnosis. And that's okay. That's okay, because we can now take also response to treatment as an indicator of the underlying disease, which is really, really cool. So we can actually use our treatment as a form of diagnosis. And there is no point in arriving at a perfect diagnosis, but actually having used all of the funds available on the diagnostic testing. And this often will apply to things like exploratory laparotomies or MRI scanning that are very expensive type of procedures, and not wrong by any means, but we must pause before we proceed with them. And it's really a balance between those tests and treatment trials. But what I've got on my slide here is a really nice representation from a very recent publication, which is the AFP and Every Cat FIP Diagnosis Guidelines. And when I used to give this talk, I used to have this as a jigsaw, and they've done it as bricks in a wall, which I also like. And the point behind this is that with FIP, there's often not one thing that gives you a diagnosis. It's about finding enough bricks in the wall or pieces of the puzzle that you are confident to use these novel drugs. It used to be, sadly, to make a decision to euthanize. And some of them are slightly more valuable than others, but they all go together to create that picture. And it might be that you don't have that final puzzle piece or that final brick, but you have enough to make that diagnosis. And that's what we're going to talk about. So just to show you, these are open access guidelines. You can just Google them. I put a link there, but you can just Google them. And they are, really comprehensive, but they also have some good pull-out bits of information that you can look at. Also, just wanted to give you another heads up of really good materials, and that's the ABCD, who are a group who study cat diseases, infectious diseases, and they've produced these really lovely algorithms. And they were made by my colleague Sev Tasker and others who are also involved in our email service, but basically take you through an algorithm. So really, really simple, and help you come up with the confidence to make a diagnosis. And they have these categories like FIP very likely. And I will say in our studies, the majority of cases, that's as good as we get, is FIP very likely or highly suggestive. And that's where we often get to. So I've alluded to this, and I just wanted to put it in a diagram, really, just to show you the way I see it. So on a seesaw, essentially, we've got on one side our diagnosis where it's important to exclude other causes that would have a different treatment, and potentially diagnostics to confirm our diagnosis. And then on the other side, we have to think about, the treatment and the monitoring, and budget for those as well as the consultations, because we all know these things can really, really add up. And it is this kind of seesaw, and in the middle of it is the owner's funds. Now, anyone who hasn't used the new drugs, I am talking UK prices here, but these drugs are available by export from the UK to other countries, and they're widely available in Australia as well. But in the UK, I just wanted to show you some approximate costs, because if you haven't used these drugs, you might have slightly fallen off your chair at this point. And it emphasizes why we need to be so careful, because even a kind of straightforward case is going to cost several thousand to treat. And if we have a very sick cat, a complex case, or one of the neuro cases that require higher doses, we start to get into some big bucks. And that's why we've got to be so careful. Let's take you back. Let's keep you awake and just give you a bit of revision. And I know we could have an audience of people of different experience of this disease, but let's just remind ourselves about FIP, and particularly coronavirus, because there are also a lot of misunderstandings surrounding this disease. And that's really been emphasized to me since we started to talk about the treatments. So here he is, he's a coronavirus, and obviously that's a topic of great conversation. So we always, when we speak to clients, have to pause and go, not that coronavirus, it's a cat one, before they have a panic. But basically, feline coronavirus is everywhere. It's all around, every country, and the prevalence of it within the cat population can, in multi-cat households, be incredibly high, and up to 100%. And that's because it's very, very contagious. So it spreads by a fecal-oral route, and it spreads between cats very rapidly. It's an RNA virus, and that is important because it means that it mutates like human coronavirus. It mutates rapidly, and we heard about all the different strains, didn't we, of kind of human coronavirus. And this virus, when it's circulating, this feline coronavirus, it will mutate. And that's important because that's probably part of what makes up the combination of bad things, bad luck, you could say, that ends up in FIP. There are a couple of serotypes, but what I want to stress is, much as I love talking about FIP, the majority of cats that encounter coronavirus, the vast, vast majority, will not develop FIP. And it's important that owners understand that. Actually, when you look at the figures, FIP is not that common. People have been asking me, is it more common now? And I said, probably not. We're just more aware of it, and we're talking about it more because we've got treatment. And in general, this causes a lot of confusion for owners, and a lot of things that you and I don't like owner Facebook groups and Googling and misinformation. And we must be very, very clear when we talk about it. And actually, even in the veterinary profession, there's a lot of that misunderstanding. And we get lots of questions. I have to look things up and make sure what I'm saying is totally correct. So let's think about how coronavirus causes FIP. Now, we can spend a whole lecture on this, so forgive me if I go too quickly through this. That lovely diagnosis guidelines will go into more detail if you want to follow up and read that. In the majority of cases, coronavirus goes through the cat, essentially. It goes into the intestine. It may cause a mild diarrhea, it may not, and in probably most cats it doesn't. And it passes out to the other end, so therefore, if we do fecal testing, we'll probably find it. It can cause enteric signs, as I said, or it can just do nothing. But what it can do in this process is it can leave the intestine. Now, some years ago, we thought that leaving the intestine was this important key step in the development of FIP. And certainly to cause FIP, this coronavirus must leave the intestine. That makes sense. The disease is a disease of all parts of the body. It's a systemic syndrome. But actually, work from Bristol showed that the virus can leave the gut, and this is true in other species as well with their own coronaviruses, is that it can leave the gut. It likes macrophages. It loves to travel around with them. But that doesn't mean that the cat's going to get FIP. And this is what I mean when I talk about this series of bad luck steps that result in FIP, because this is your first bad luck. It's left the gut. Your second bad luck is how the immune system responds to that virus. And that's why we can almost call it an immune-mediated disease, because in some cats, their immune system will deal with it appropriately. And in other cats, it will cause this huge inflammation and pathogenesis of FIP. So if you get infected with coronavirus, and here's our little Hudson here, actually looking a bit better, isn't he? His ears are up. Note the difference between his ear angles from this picture to the previous picture. But what's happened is that he must have met coronavirus through this fecal-oral spread. And some cats seem to be quite resistant to coronavirus, so it doesn't really do anything to them. The vast majority of cats will have this transient infection that we talked about. There may be some replication in the gut. It may even slightly leave the gut, but it doesn't cause any problems. And then we have a few cats, and these can cause some hot discussions and problems within breeding and multi-cat homes. But you have some cats where it seems to kind of circulate within the cat, and they persistently have positive fecal results. So they are what we call persistent shedders. And so they are contaminating the environment in many ways. Those are a difficult group of cats, and we can get in the Q&A if anyone wants to ask me that controversy of how we deal with those cats. And then we've got this small proportion of cats that develop FIP. So I think you can see that actually, when you look at that the majority of cats will not develop FIP when they encounter coronavirus. So again, looking a little bit about the outcomes in slightly more detail, we've got this coronavirus in the intestine, and what we probably have is a mutation within the individual cat. We know that there are mutations going because it likes that, the virus, and we've got our group that it will replicate in the epithelium of the intestine, and we know that we can have some systemic spread. But we have these different outcomes. So these are the cats that develop FIP. So they've had coronavirus in their gut. There's probably been a mutation within that cat. And then we've had systemic spread within the macrophages. But also that virus is really good at replicating. So it's got it down, it's replicating. And then the immune system of the cat has responded in a particular way. So most of these groups do not develop FIP. So just to put it in perspective, which I think we have to a little bit. So which cats are more likely to develop FIP? I've mentioned to you our Posh cats, and basically being a Posh cat seems to mean that you're more likely to develop FIP. But also stress. We saw in Hudson's history that he'd been neutered, and that's something that when I go through the data is not completely uncommon, that cats have been rehomed, they've been neutered, another cat has been brought into the household. So again, you can see how some confusion can come in there as to how it's developed. Has it been infected? Have cats been infected? Have they caught it somewhere? And these type of terms, where actually it's probably a stressful process. And then we've got our Poshies, as we said. And if you look at the research, the publications look at things like Burmans and Bengals. But as I've said to you, in our study, I think we see a lot of British Shorthairs, a lot of Maine Coons. But I think that may represent also popularity of those breeds. And then where the cat comes from. So people sometimes say, well, this cat is living in a single cat home. How the hell is it indoors? How has it caught coronavirus? But remember, they can carry coronavirus in their gut for some time. And so they may now be in a single cat home. But if you look at the origin of most of our cats, they come from multi-cat environments, don't they? They come from breeders, potentially, for pure breeds, or they come from shelters. They come from situations where there are probably lots of cats. And it makes sense that if you've got more coronavirus hanging around, so if you've got overcrowding or poor hygiene, these are causes of stress, but they're also causes of having tons of coronavirus around you. And then we know that young cats, we know that the first time you meet coronavirus in this way is the time that you're more likely to develop FIP. There is a peak later on, so we talk about seeing cats around 10 years old. But I can tell you that in our studies, the vast majority of cats are under a year of age. So it's really a disease of young, cute, posh cats is what my summary would be. And we also think that if you're co-infected, but actually in the UK and many other countries, the level of FIV and FELV is quite low. So we're not seeing many positives of that. What we do see sometimes, talking about other diseases, is cat flu cats. So little cat flu kittens then developing FIP, probably because of stress and immune system effects. So what are some of these misunderstandings? I think I've sort of alluded to them anyway, haven't I, with you, that cats with coronavirus, the owners know that coronavirus causes FIP. And so they therefore think my cat has coronavirus, it will develop FIP. And this can be a real problem. It can be a real problem with understanding, and it can be a real problem with novel treatments and owners potentially requesting them for cats that have positive fecal results for coronavirus, which, you know, obviously you and I can't promise that that cat won't develop FIP. We'd be foolish to make those type of promises, just like we can't promise that it won't develop mycobacteriosis or any other condition. But we can say that the majority of cats that encounter coronavirus will not develop FIP. And so we have to really remind them of this fact, and that in multi-cat homes, up to 100% of cats, when we test them, have met the virus and developed antibodies. And we're going to talk about antibody testing in a moment as well in some detail, because that's another area of real misunderstanding. But I often say to people, if you tested my cat, he could be positive. He could be shedding coronavirus. He meets other cats outside. Well, I don't know what he does outside. I don't see him for half the day. So, this sort of misunderstanding that the presence of coronavirus is going to cause FIP can be really, really worrying. It doesn't mean that I don't underestimate the importance of hygiene and things like cleaning up litter trays, and particularly in multi-cat homes and breeder homes, being quite diligent with that kind of hygiene. But it doesn't mean that they will develop FIP. Now, clinical signs, I find it a fascinating disease. I used to find it an incredibly depressing disease, although very interesting. I guess now I find it more interesting because we can actually do something about it. But it is a disease that can have lots of different clinical signs, and some of them are much more familiar to you, I have no doubt. So I've got a picture on the screen here of a yellow effusion, and we know that cats with effusions in their abdomens and chests, we're pretty good at recognizing those cats as potentially having FIP. And I think it wouldn't be unreasonable to say, if you have a 6-month-old British short hair with an effusion of that color, that it's FIP is at the top of your list. There are other differentials, but that's got to be at the top of your list. And then we get the slightly less common presentations, and they tend to be the ocular cases and the neurological cases, although it's still not uncommon, and FIP is a common cause of neurological signs in young cats. Remember, with Hudson, he had a slightly high bilirubin, and you can see in this cat I've got here at the bottom, slightly to the right, has got a slightly yellowish tinge. And jaundice or hyperbilirubinemia is not uncommon with FIP, but what I will say is that these cats are not bright yellow. They are not so jaundiced that you can sort of see them from the waiting room. They tend to have bilirubins under about 50 or 60, so they are not severely hyperbilirubinemic. And if you had a cat with a bilirubin of 150, I would certainly be telling you to look, after you've ruled out hemolysis, be looking at the biliary tract rather than looking for FIP. But we do see a lot of them. When you measure their bilirubins, they are elevated. Other things that we've got on the screen here, I've got an MRI scan here that shows you the effect of FIP on the brain. So FIP will cause granulomas in the brain, but it will also obstruct the drainage of CSF. And a lot of their clinical signs come from essentially acquired hydrocephalus. So you don't have to be, and I am not an MRI expert, to see that the ventricles are very dilated. And actually, in its worst case, this will cause herniation and obviously death. So these kind of multifocal neurological signs are what we see. And then I've got an XLAP there that just shows you the severe kind of serosal changes that you can have when you look grossly. And then we get big lymph nodes, and I'm going to talk slightly about ocular signs in a moment. So really quite diverse. But the most common clinical signs are pyrexia. Now, pyrexia is really common in FIP. So the vast majority of cats with FIP, unless they're neurocats. Neurocats are the exceptions to every rule, but they will be pyrexic. And especially if they're effusive, those cats tend to be more pyrexic. They're lethargic, they're inappetent. We've talked about jaundice. They've often lost a bit of condition. Respiratory signs, specifically if they have a pleural effusion. And then you can see a cat on here. This is Archie. He is the first cat that we treated at Lumbury, when I worked at Lumbury Park, for FIP. And you can see that he's got a big abdomen. He's got ascites. So those would be the kind of common ones. And I would say lots of cats that we see with FIP have these signs. And I just want to interrupt myself at the moment because you may not have heard me say the words wet and dry FIP. So anyone who learnt about FIP, like I did a few years ago now, when I was at college, we've really talked about wet and dry FIP, and people still do, and that's reasonable because there are some cats who are effusive and there are some cats who are non-effusive. But what I would say is that they are not that's not a defined division between the two types of presentation. Things can change. They're probably just different phases of the same disease, and they show you that the focus of inflammation is in the abdomen or the thorax, and serosal, for example, more of a vasculitis. Actually, when you have the misfortunes, I did when I was working at Bristol, to do postmortems on cats with FIP, when you look for it, you find it in other places. That's important diagnostically because before we rush to an MRI, we ought to look for an effusion in the abdomen, because that's going to be much easier and cheaper to make a diagnosis from. So don't think of it as this kind of defined division between the two. It just happens that they're phases, different phases of the same disease. And some of these less common clinical signs, and the picture here on the right is a cat that we've been treating very recently. I haven't been treating it, but we've been sort of helping the owner and the vet. And the owner sent me this picture just this week. And this is how her cat had presented, but it was also had pyrexia as well. And so ocular signs can be quite subtle. You know, that's not a huge change that you can see there. But what they do have is a lot of inflammation in their eyes. So if we're seeing young cats with uveitis, chorioretinitis, and as you can see in the picture on the left there, they're chorotic precipitates, so kind of cloudiness to the eye there, we've got to start thinking about it, and it raises huge red flags with me. When we think about ocular signs in young cats that are anything that would fit, otherwise I start to worry. And actually, ocular cases can be quite challenging because you and I don't want to be doing aqueocentesis, so sampling the fluid in the eye. I certainly am not quite brave enough to do that. And so these cats can be quite delayed in their treatment. And I would encourage you to get an ophthalmologist's opinion quite rapidly with these guys. We've seen some that have been delayed, had a lot of eye drops, etc., quite reasonably. But actually, let's have that FIP in the front of our minds so that we treat them quickly. And neuroscience, I've mentioned Neurocatsu. Here's a post-mortem picture of one of those brains, a bit like in the MRI scan, which I've again included here. And you can see these big spaces. But on histology, you'll also see granulomas and other lesions there. And in the CSF, we find is significant inflammation. Neurocats, I think, can present in different ways. You can get cats that are very severely affected. It perhaps depends how quickly they have been presented to you. And you can have cats that have very subtle ataxias, for example. And they can be really difficult to diagnose because you don't want to spend for an MRI on a cat with a subtle ataxia immediately. But actually, those are the cats that can have FIP. So it can be really, really quite difficult. I think having young cats with neurosigns, again, immediately red flags to me, particularly those little Posh cats. And as I said, we can look for disease elsewhere because it's a damn sight easier to look in the abdomen than it is to look in the brain. Some cats will have very severe neurological signs, and these are really difficult cats to treat. And I've got a sort of slightly upsetting video for you here, so I apologise, I don't like looking at this video. This was a cat that had presented to us at Lumbury Park with subtle signs, actually quite subtle signs of inappetence and vestibular changes. That was all. And the cat was booked to have an MRI the next day because it wasn't at all clear. And as you can see, it's not a little tiny Posh cat. I think the cat was about a year old. But then actually how quickly things can change is that overnight, the poor night guys saw the cat start to have, basically it might be a bit jumpy on your screen, but seizure activity is what we're looking at here. Remember, cats do subtle seizure signs, so we've got some episiotonis, we've got stiff forelimbs, and the cat's kind of panting. It looks like almost a respiratory case, but when you get closer, there's a change in mentation as well. And these cats are, as I say, challenging to treat when they become in that state, which can happen quite rapidly. So what about little Hudson? What did we see when he came to see us in referral? So he came to see us because of those very confusing and kind of misleading results that he had. And I think you can see, again, I know I'm kind of obsessed with his ears, but you can see how poorly he's looking there. And what I'm trying to badly demonstrate in his abdomen, I look like I'm horribly wrestling him. I was being nice to him. That's my hand, so you can blame me. You can see maybe a subtle jaundice with an pallor. Could you appreciate that? Maybe we could agree on that. It's difficult on the screen, but I think we could see a little bit of pallor, a little bit of jaundice there, perhaps. Okay, and just looking really, really miserable, really pyrexic, and pretty much the things that had been reported at the vets. And his abdomen did look slightly distended, and you could palpate this mass. And going back to that, it's very easy for you and I to immediately assume that he has FIP, and he's included in this talk because that is a very likely diagnosis. But it's important that we rule out some other things. So one of the diseases that will cause an abdominal effusion in a very sick cat would be a septic peritonitis. Now, that can occur in a foreign body case, all sorts of kind of different things that can result in septic peritonitis. It's not common, but we certainly want to exclude it because it's a surgical emergency. Very confusingly, and this is really confusing, the odd cats with FIP develop sepsis. So when they're very severely unwell, they are so immunocompromised that they will develop sepsis. And they can be really confusing because the fluid that you get out will have bacteria in it and it will look like a septic abdomen, but actually they've got FIP. And that's really, really confusing and challenging to deal with. Unfortunately, lymphoma can affect young cats as well as old cats, and we have diagnosed cats of under 1 year with lymphoma. And so we have to have that on the list. It's a multisystemic disease. It can also cause effusions. Things like toxoplasma and mycobacteriosis can both cause effusions and neurological signs potentially. So you can see that they could be confusing, but they're not terribly common, but we have to have them in our mind. And then this condition called lymphocytic cholangitis. Now, that is a great mimic because it can cause high protein effusions in the abdomen. And it possibly occurs more in Posh cats, so you can see Persians and things with it. So that can be very confusing as a presentation, but they tend to have high liver enzymes, whereas FIP cats can have mild liver enzyme elevations, but they're not usually super high. So it's just to throw that out there. So have a look at this picture here on the screen. I think if I asked you guys in a poll of to bet, how much would you bet that this effusion is from a cat with FIP, £10, £20, more than that. It looks really like it, doesn't it? But actually this is an effusion that was found in a cat with lymphoma. So you can see how it is easily to be misled in this way. There are clues, and there are great clues in the bloods that we can find as well. So many cats with FIP have a mild anemia. It's a non-regenerative anemia in most cases. Very weirdly, you can get the odd cat with IMHA as a result of FIP, but they're not common. Often have a neutrophilia. It's not sky high, but it's there. And we've talked about the high bilirubin. And the other thing that they very often have is a high globulin, and this is something that you will be familiar with, that cats with FIP have a hyperglobulinemia, but not all of them, just to confuse you. So in neuro cases, for example, everything seems to be very kind of just in the brain, and those cats not necessarily have a high globulin. Some of them have a globulin of 100, they have enormous globulin. Other cats have a more subtle hyperglobulinemia. So it's a bit of a funny one there. People often say, oh, should we run an SPE to look at what type of proteins we have there? So a serum protein electrophoresis, and to look at whether we've got a monoclonal gammopathy or a polyclonal gammopathy. Now, almost all cats with FIP will have a polyclonal gammopathy. But monoclonal gammopathies are reported with FIP and also with things like multiple myeloma, but they are also rare. I would save the money. I would just accept my high globulin and look for other signs of FIP to support your diagnosis. So here's Hudson's bloods, and I showed them on the previous slide and I'd stolen them from him. So he had that classic hyperglobulinemia, not massive. He also had that high bilirubin. So you can see that there. He fits with that. He also had a non-regenerative anemia, as we said before. So I just want to bring in here a slide about acute phase proteins, because we're talking about proteins and elevations in our gamma globulin, our globulins. And actually, acute phase proteins are something that are often tested. They're often included on FIP panels, which is something that I don't particularly like, FIP panels, and I can tell you why in a mo. But actually, AGP has been shown in several studies to be severely elevated in most cats with FIP. And our data would support that, with again the exception of some neuro cases and just some other early cases where their AGP is not massive. So I wouldn't exclude it completely. It's another brick in the wall, isn't it? It's another piece of the puzzle. So think about the costs of running AGP, and some people in other countries can't run AGP. And so that's a bit frustrating, because it also may have a role in monitoring cases, which I'll tell you about in our treatment kind of section. I was going to be subtle, and then I thought I'm not going to be subtle. Hopefully Lisa won't tell me off, but I'll be quite definitive here and tell you that I hate coronavirus serology. And you're probably saying, well, why? It's on all the FIP panels, probably why I don't like the FIP panels. And that's because it's a really, really misunderstood test. Now, if you're running this, don't feel bad, because many referral centres who've given me data run coronavirus serologies, and I've worked with many colleagues that have run coronavirus serologies, but it is really, really misunderstood. I say it's frequently run. Why don't I like it? Well, it only tells you exposure. So what we're looking for are antibodies to coronavirus. And earlier on, I told you that in some households, 100% of cats will have been exposed to coronavirus. That means 100% of cats will have a positive serology in those households. If you got my cat off the street, he would probably have a positive serology. So how has that helped me with my diagnosis would be my question. You might say to me, well, in FIP cases, the serology is very high. And you would be right. In the majority of cases of FIP, they have a very high coronavirus serology. But you will also find that in cats that have encountered coronavirus, so all of those other groups that we said who meet it and deal with it. And actually some work that was done some years back now, looking at cats with high coronavirus serology results and following them, they didn't develop FIP. They had just been exposed to coronavirus, and they had very high titers. So I think that it does not add enough for me to want to spend the money on it. And when we are talking about the treatments, it can actually also be a little bit dangerous. And I'm going to show you a little video here. This is a very cute little cat, isn't it? This is Oscar here, very cute. Now, anyone who doesn't like sort of funny feeling wrinkly cats may be he's not so good, but I think he's cool. I like him a lot. I think he's a dude. Now, this cat had 12 weeks of treatment. Okay, so 12 weeks of treatment for FIP. And that involved at that time, because of the drug availability, injections. So this cat had 12 weeks of daily injections, subcuts, which I'm sure you can imagine is not very much fun. But he was diagnosed on the basis of coronavirus serology, and he never had FIP. So it can actually be a little bit dangerous to interpret and hang our hats on coronavirus serology. And I'm sure you guys, after I've bored you with this, will never do that. And if you look at those guidelines that I keep mentioning, they actually conclude, after a lot of discussion, that antibody testing in serum, plasma, or any other fluid is not recommended for the diagnosis of FIP, because it's so damn confusing. It's no use for monitoring, so I don't want anyone to be monitoring, because, as I say, it could say elevated. It doesn't reflect their status as an FIP cat. So just remember that it's just showing you exposure. It doesn't equal FIP, and most cats will be positive if they have met the virus, and they can remain positive for over a year. They can remain positive for a long time. Now, if I'm being diplomatic, the only way I can see that it's useful is if you have a situation where it's unlikely that they would have encountered coronavirus, and you had a single cat household and the cat's been kept indoors for a long time and it has sky-high titers. And then I'll give you a brick. That's all I'll give you, just a brick. Or you could just not run it and save that money to look for fluid, for example. So I'm a little bit ranty on this, so I apologize for that. What's much more useful is imaging, and we've said about our issues with MRI scanning and the cost of it, but it's certainly very useful for the diagnosis in neuro cases. But you can see that finding free fluid is very, very valuable, and so imaging of the abdomen and the thorax is, really, really, really very valuable. And you might be thinking, well, I'm no ultrasonographer, I'm not very confident doing ultrasound. seriously doesn't matter at all. What we're looking for is the black stuff that indicates the presence of fluid, because we immediately then know that we want to sample it, and we immediately have a list of differentials. And we did that all by placing a probe on the thorax or the abdomen. So please get your ultrasound out. We don't need to be x-raying any dyspneic cats at all. Actually, we need to be focusing them and looking for fluid. And so think about, doing that from a cat-friendly clinic point of view, because that's my other life, is working with ISFM and cat-friendly clinic in particular at the moment. And you look at this picture here. What we've got here is my lovely friend Helen is doing a scan of this cat's thorax. We've got a comfy bed there, and we've allowed the cat to adopt a natural position. We're not heavily restraining, and we will immediately answer that question: is there fluid or is there not? And that is, a big deal in dyspneic cases, and it's a big deal when you're looking for samples to take for FIP or to increase your likelihood of FIP. So I always say this to the neurologists that I've worked with, stop taking it to the MRI before you've looked for a bit of fluid, because that's what we do down in medicine is considerably cheaper sometimes in that way. And the other thing is that this changes, as I said to you about wet versus dry. This is a progressive disease, and so it may be that a cat that did not have fluid last week will have a bit of fluid now. So if we're struggling with diagnosis, I will often say to people, I know it's really annoying, but I think you should rescan, because at that point you might find a bit of fluid, and that's going to be really useful. So my tips and tricks on that are to look for the fluid. And as I said, you don't need a Posh scanner, and you don't need to be an expert on scanning. We're literally answering yes or no questions, and that's all. And I'm no ultrasonographer myself at all, but we can all see the blackness that is free fluid in a thorax in this case. And a lovely chap who kind of invented AFAST and TFAST is a Canadian ECC chap. And he always says, if you can auscultate it, you can scan it. And I think that's really true. And he's actually done these funky studies where they taught students literally in a very short tutorial about how to find fluid, and they could all do it. So we can get your ultrasounds out and be looking for fluid. If you find it, then sample it. It's actually more useful than blood tests in many ways. You can exclude those cats that need to go for surgery because they've got a septic abdomen, and I want you to do that. You can analyze it in-house, don't forget that. So sometimes we get delays because we've sent off fluid, maybe it's a Friday, now we're not going to get the result till Wednesday because of the time it arrives. So remember, you can, with most in-house machines, put the fluid through and measure albumin and globulin. And knowing that albumin and globulin ratio is really important in the diagnosis of FIP if you have fluid, because we know that cats with FIP tend to have a low albumin to globulin ratio in their fluid. So immediately, by getting a bit of fluid, looking at it yourself and putting it through your machine in what I challenge you would only take about 15 minutes, you can make septic abdomens less likely. You can see if FIP is likely from your AG ratio. And some people do this thing called a revolter test. So if you haven't heard of this, it's basically putting some vinegar in the fluid, and high protein effusions will have a sort of blob that goes down. You can Google it and there are videos, but not many people use that these days because you can just measure albumin and globulin on your machines. Some people do it, still do it. But all it tells you, it doesn't tell you it's got FIP, it just tells you it's a high protein effusion. So get the fluid is my message. As I said, we've got this low AG ratio, which is consistent. And the cytology of effusions of cats with FIP tends to have sort of basically mixed cells. So some neutrophils, some macrophages, a few lymphocytes. That's what you tend to get. And that's really, really common on the cytology. And as I say, you won't see bacteria in most cases. You can run acute phase proteins on fluid, but it probably doesn't tell you any more than if you ran it on the blood, and it probably doesn't tell you any more than looking at albumin globulin ratio. But importantly, we can send it off to look for coronavirus in the effusion, and that can be really useful. So we'll talk about how we do that in a little bit more detail, but that's going to be by PCR or immunocytochemistry. So what about an FNA? What about taking FNA samples? Well, Hudson's vets had done that very diligently. They'd taken a sample, and I think they just had him at a different point of the disease, and their samples just showed a kind of necrotic areas. What we can do, and people don't think about doing FNAs all the time in cats with FIP, but we don't need sort of a big needle. I don't know, I put high needle on that slide, forgive me. We don't need a high gauge needle is what I'm trying to say. You only need a small needle, and taking samples from things like kidneys that look abnormal, liver that looks abnormal, and lymph nodes will often give you this information. Or again, exclude things like lymphoma. So remember, lymphoma is, quite an exfoliative cancer. So you do find it places, its cells don't stick together very well. So if we are trying also to exclude other things, then this could be quite useful. We can look at cytology, but you can send fine needle aspirate samples for PCR, and you can send them for immunocytochemistry as well. So actually, FNAs can be submitted for more than just cytology. This picture here was sent to me by, I think it was a vet in China who, and actually in Asia, they see lots and lots of FIP because they do like purebred cats, and they're often kept, they sort of sell them in pet shops and things. So maybe I've not been out there, but I think that stress is not necessarily low. And they sent me this picture because the fluid that was removed is kind of bigger than the kitten, isn't it? Very sadly, but I find it quite a shocking picture in that way. So remember, I told you have a look yourself in-house, but you can send fluid for PCR testing to look for coronavirus in the fluid. And if you start to get, if you have coronavirus in a fluid that fits FIP, that's pretty much, some people would consider that diagnostic. We tend to label it, in accordance to the ABCD guidelines, as FIP very likely on the basis of that. And something like immunocytochemistry is really underused in the UK. So in other countries, they send it. And what this is basically fluorescently labeling coronavirus in your sample that you send off, be that an FNA or a fluid sample. So what they're doing is they're showing that there's coronavirus in macrophages in your sample, which is pretty much diagnostic of FIP. Okay, and false positives are really, really unlikely. So that's actually a really useful test, and it's not super expensive. So if you are struggling, obviously send us an email, we can talk you through it. But several universities in the UK run this. And if you're listening from around the world, there are in other countries actually wider availabilities of these tests. But have a word with your lab and make sure you sort of handle the sample okay. So with Hudson, when we saw him, things do change. And now by the time I saw him, yes, he had a big lymph node. This is a jejunal lymph node, but he also had free fluid. And so we could sample it. So this is a little slide about immunocytochemistry, just to show you what it looks like. So it is identifying the bug in the macrophage. And that's really, really obviously very useful. So we won't spend a lot of time talking about this, but just if you're interested, have a word with your lab, because there are certain ways of handling the samples that can be more useful. Okay, so we can take multiple samples into saline, for example. So these are some different ways. Just before we move on to treatment, I want to talk about PCR just for a moment, because I think PCR is really, really confusing for coronavirus. Remember, not for FIP, but for coronavirus. I'll tell you off if you say it's for FIP. The bottom line is that when you are looking at it, you've got a reverse transcriptase PCR, and that's called NOT. They tend to be abbreviated to RT-PCR. And the way my small brain deals with that is that that's a yes or no PCR, basically. So that says we have coronavirus or we don't. You can also have a quantitative PCR, which tends to be called, confusingly, a real-time, I know, or Q, quantitative PCR. And that tells you how much virus is there. So that tends to be pretty useful, because it will tell you whether you have a high amount of virus. And then there is also the IDEX Real PCR, which is available looking for gene mutations that has been associated with FIP. But we'll talk about that in a moment, because I'm going to encourage you to run a reverse transcriptase or qPCR. So the problem with these FIP PCR tests, so looking at mutation analysis, which is offered by some labs, so they look at these spike proteins, and they produced a paper that showed that these particular mutations of the spike protein show those cats invariably had FIP. And so that looked really good. That looked absolutely great. We can find out that it's an FIP causing coronavirus. But then we came back, as happens, Bristol produced this lovely paper where they showed, actually no, what those mutations show in that gene is an ability to kind of leave the gut and spread systemically. Now, that doesn't mean that those cats have FIP. And so there are limitations to that. And there's a possibility that by looking for specific genes, you reduce the sensitivity of the PCR. So I know this is quite a lot to kind of take in. It's explained quite well in those guidelines, so I will leave you to refer to that. PCR is very useful in the diagnosis of FIP, but just, sort of have a look at which type of PCR you're using, because what we want to know is there coronavirus in the sample that we're sending? And we may also ask how much there is there, depending on what we want to do. And then, tissue biopsy, you may get this far. Not many people do, but you may get as far as taking biopsies. And you can see, obviously, some dramatic changes in granuloma formation. You see why you get fusions, can't you? It's so inflammatory. What you all want to know is about treatments, and that's what I'm going to finish by telling you about. But first of all, people also ask us about treatment trials. And in some cases, as I've said to you earlier, this is appropriate because it will tell us the response may give us information about diagnosis. And what I say is that's absolutely fine, but we're not going to throw it at every cat. We need to have a duty of care to do a minimal amount of diagnostics, taking into account the cost, to rule out other diagnoses. And the owners need to understand that we are treating with these drugs without a definitive diagnosis. Also, whenever we do this, I want you to have objective measures of response, because it's otherwise placebo and we all want these cats to get better. So be that blood results and looking at globulins, be that looking at bilirubin, or be that doing daily neurological or every other day neurological exams so that you can see if there's an improvement. So what I would say is absolutely yes, but with a minimal amount of kind of, absolute diagnostics that must be done and our monitoring. So at this point, would we treat Hudson for FIP? I've got quite a few puzzle pieces, haven't I, or bricks? I've got pyrexia, I've got free fluid, I've got a young purebred cat, I've got anemia, I've got hyperbilirubinemia, and I've got hyperglobulinemia as well. But I don't currently have results that show that I've got coronavirus there, have I? And I haven't looked at my fusion yet to exclude a septic abdomen and that being an abscess, that lesion. Maybe now we've got fluid because that was an abscess. And he's also really difficult to tablet. And in fact, when I told the owner about the treatment, she cried. And I thought initially it was joy, but actually it wasn't at all. It was her thinking that she couldn't tablet him for 12 weeks, which I do understand and we'll talk about. So what we did is we did submit the samples to the lab to find out a bit more. And here's where things can become very confusing. So some effusions will come back negative on the PCR, and you're probably thinking, well, how can that be in a case with FIP? But what can happen is, PCR is not perfect. They need a certain amount of viral RNA in order to be positive. And so in fluid, and particularly big effusions, it's all quite diluted basically, and you can get a negative result. But we did do our cytology to rule out other things, and we did examine in-house, and we saw a mixed inflammation. And actually, we had repeated the lymph node samples, and that came back positive on coronavirus PCR. So you're probably thinking, well, oh God, which way, are you going to go there? But I think from my point of view, we have a lot of evidence for this cat having FIP. So what are we going to treat him with? This is why you're here to talk about, and these are the nucleoside analogues. So what happened was several years ago in 2019, I think, the god of FIP, who is Niels Petersen, published this paper showing that this drug called GS441524, which I'm not going to test you on, it's ingrained on my brain, but it's a lot of numbers, so I won't test you on it. We call it GS. He was actually giving it by injection. So you can give this by injection. We'll talk about the differences between this and remdesivir, but he was giving it, and essentially it worked. So a lot of cats responded, but they did have quite a lot of relapses, okay? But the point was that these cats that all died suddenly survived, which is, epic for us. What was really frustrating was we couldn't get the drugs. So the patents were held by pharma companies. They didn't want to release them to cats. They saw there was no money in it for them because there aren't that many cats that have FIP. And so we had to sit tight, which was very, very frustrating. Also, while we sat tight, a lot of illegal drugs were available, and that was a lot of controversies about that. But in 2020, brilliantly, remdesivir came. Now, this was a drug where COVID helped us. It was a drug that was available for human COVID. Okay, and confusingly, the trade name is called Veklury, which sounds like it's a veterinary product, but it isn't. That's actually the human product. And the company that made it is a company called Gilead. And they had a turnaround, and we don't really know why, but they said they would sell it to vets. But it was super expensive. So really, really expensive. So some cats were treated in the UK and it worked, but it was cost prohibitive for the majority. So we got excited and then we were less excited after that. But what had happened in Australia in the meantime is that a company reformulating pharmacy called Bova had released remdesivir. Now, remdesivir is another GS and some numbers. It's GS 5734. But they're the same drug because it's metabolized to GS 441524 in the cat. So essentially, GS and oral remdesivir in the UK is an injectable product, and GS is an oral product. You will find some illegal drugs that have injectable GS. These are all nucleoside analog antiviral treatments. Okay, often they've been tested in humans and discarded, that are sort of not useful for some viral diseases in humans, and therefore they've then been picked up by clever people to look at them in coronavirus in cats. But finally, we had a legal source, and the Australians were ahead of us. They had it about 6 months before, and they started treating cats, and they taught us loads about how we should use these drugs, and that was brilliant. So we managed to get it in the UK, and then we managed to get the oral treatment as well, which was obviously very good. So you can see it there. This is me. What you can't see in this photo is my excitement, because this is my hand holding the first ever bottle that I'd held of remdesivir. And when you work in feline medicine, you don't always get super amounts of good news, and this was amazing news, and we couldn't wait to try it. It comes in 10 milligram per mil vials, and this was also better than the Gilead product, which was a lower, it was 5 mg per mil, so you needed a lot more of it. It comes in 10 ml vials, and we give it subcutaneously or IV. And IV tends to be used for the sick cases, but because there is some pain associated with subcutaneous injection, people often say to me, if I've got an IV in, can I not just give it IV? And certainly that would be reasonable. And actually some protocols that the RVC use, who've treated a lot of cats, is to use the use it IV for a few days and then change to the oral therapy. Okay, so it's a little bit confusing, this area, and that's because there's not a lot of evidence on it. So what had been done traditionally was to treat IV for a few days and then follow with subcutaneous. But what some people are doing is then changing rapidly to oral. So this is the question. We don't know. There is a study going on in the USA about this at the moment that might answer these questions. Many cats, have been treated with oral GS alone. Now, some of those cats have been treated with legal drugs, but actually prior to that, many cats had been treated with oral drugs that are not legal in the UK, and they had been successfully treated. And those were GS-containing medications. So we knew that it works orally. What I would say is that it makes sense to use remdesivir in cats that are pretty unwell, in cats that we don't want to, it's going to, obviously some of those neuro cases, my seizure in cat that I showed you, you're not going to give that oral therapy. And also absorption and bioavailability of GS is not brilliant. And so we worry about cats that have a lot of GI involvement, that actually they don't absorb these drugs very well. So I think we take it case by case and we see, what we want to do. And I'll show you what I did with Hudson in a moment. The oral GS I've mentioned already comes in 50 milligram tablets that you can divide, and you can even crush them. Ideally, they're given on an empty stomach, but the majority of people will give them in a bit of a treat, which is fine, but just fast them kind of overnight before you give it. So maximize the absorption of this drug. If you start to get to the higher doses, divide it into 2, but actually there's evidence, pharmacokinetic data coming out that suggests maybe we should use it twice a day anyway. So watch this space and round up, not down. So what about dose? Don't worry about writing this all down. You can also find this if you go to the International Cat Care website and go, so search on Google for International Cat Care FIP, and you'll find our FIP pages there. And there is a document for owners and there's a document for vets, and it has this table in it. So don't worry about scribbling it down. The bottom line is that for cats with ocular and neuroscience, you need to use higher doses. And you might say to me, if you're someone who's read those Peterson articles and things, why are you using these doses are higher than were used? But that comes from our experience of the Australians and in the UK, that we seem to get better responses and less relapses if we use higher doses. Actually, the only issue with that, it doesn't tend to be side effects, it tends to be cost, because it makes the treatment more expensive. But by trying to use a low dose, it might be a completely false economy, because if they relapse, we've got to treat them again, potentially. And you can imagine, when I've shown you some of the figures, how expensive that's going to get. So we've got a sort of standard type of dose for cats with effusive disease and without ocular and neuro involvement, but this is flexible. So some cats, like I showed you a cat called Archie with an abdominal effusion earlier, and we treated him with 12 mg per kg, and he was better, but his effusion didn't resolve. And it wasn't until we pushed him up to 15 mg per kg that he responded. Whereas you will have some cats that responded well to 8 mg per kg, which was the kind of initial recommendation, was between 6 to 8 mg per kg. So I think that in our data, we have less relapse because we use higher doses, but it's more expensive. But if you're in doubt and they're not doing well, you're going to have to increase the dose. But I really want you to think about compliance. We're talking about weeks of oral medication, and research, that we've done at ISFM, shows how hard owners find it to tablet cats. It's really, really difficult. And Hudson's owner's reaction, I understood. I wouldn't want to pill him. Once he got better, he was a crazy little British Shorthair who jumped over my shoulder, I couldn't have pilled him. So she, I think, cried at the thought of there being a potentially curative treatment, but her not being able to get it into the cat. So if I hadn't helped her with that, she could have potentially chosen euthanasia. It's that important. But what made the big difference to Hudson is this stuff. So I know you're probably all well aware of Licky Licks. It's a liquid treat. Others brands are available, but lots of cats love it. Some cats don't, but lots of cats do. And he had 12 weeks of GS that was crushed into Licky Licks, and to feel better and eat better. Once he started it then was not such a problem. But we must help our clients. Here's another cat. Now this cat here is another brilliant cat, and he had a lot of oral treatment. And he would take his tablet. This is a GS tablet. It's probably a little bit jumpy in your screen, but you'll get the impression. Is with a bit of Licky Licks on the tablet, he eats it. He looks a bit surprised at what he's done, but he sort of forgives his mum. So he's called Leo, and he's really, really cute. And both of these cats are doing well. What about practicalities? I keep talking about 12 weeks. Why? And that's because macrophages live for ages, and the coronavirus can essentially hide in them. So we kind of need those to die out. And if we stop earlier, we do risk relapse, but there are cats that are cured on lower courses. And the dilemma is always, if owners have a finite amount of money, as to whether we just hit them with 6 weeks of the high end of the dose and cross off everything. And that's something that if we do, the owners need to understand the risks of. We only want to stop, just going back to when we stop the treatment, it might even be longer than that. The majority of cases are successfully treated with that duration, but there are some cats, but not the majority, that are treated for longer if their bloods remain abnormal at the end of their course. And what do we see? The pyrexia resolves in days. It's awesome. You will love it. Anyone who's treated a cat will know it's brilliant. Effusions take a little bit longer. Don't leave them too long. And things like hyperglobulinemia can take a while, and globulins can actually even go up. They've got this big effusion that's full of globulins, so they need to reabsorb that essentially. And so reabsorbing that, the globulins can spike. Don't be disheartened. Look at how the cat is in itself. And anemia can take a few weeks. So those ClinPath things have a variable kind of response, but I would say things like bilirubin should return to normal very, very rapidly. Pyrexia should resolve very quickly. I would be worried if a cat had pyrexia a week after treating. And this AGP, if we have the facility to monitor it, does seem to normalize before the globulins. So here's Hudson, here's what we did. So here he is looking sad again, I think you'll agree. We started actually treatment. I was so confident at the point that we'd found fluid and with his blood results, and once we'd done cytology on the fluid, that I actually gave him a dose of remdesivir under his sedation for ultrasound. And that was a balance of probability and discussion with his owner. And as I said, we may get some diagnostic information from how he responds to treatment. So with a shaky hand of my, our early use of this drug. But what happened was that he improved so quickly after one dose. So here he is looking sad in the consult room. And then the next day he started attacking my resident shoes. So this is him attacking my resident shoes. We wondered what this behavior was about the shoe attacking. But when I mentioned it to the owner, she was like, oh, that's brilliant. That's what he always does. I told you they're monkeys, the British Shorthairs. So this was, obviously a brilliant response and very helpful for my diagnosis. So obviously I don't have the PCRs back at this point. Oops, can't move him on. Let's move him on. So what do we monitor? Monitoring is going to really depend on money, I have to tell you, because there are some clinics that have monitored every 2 weeks, to see that they're getting improvement. I think it's more important to look at things like 6 weeks and then again at like 10 weeks because you're considering stopping. It's also really important in these little cats to keep weighing them. So we tell our clients to buy a pair of cat scales to have at home. They're actually really cheap. You can buy them on Amazon. Either if you don't search cat, you can buy baby scales that are now around £30. They're much cheaper than they used to be, because these little purebred cats can gain 2 kilos, in 12 weeks, because they feel so much better and they're growing. So your Maine Coon is going to put on loads of weight, and your mg per kg dose is going to fall. So we must weigh them. I think clinical response is vitally important. And in our data, we have cats that have been monitored hardly at all by purely clinical exams, and we've had cats that have had, as I said, every 2 weeks bloods. Really variable. Don't spend all the client's money on monitoring. Okay, there's no cat that we need to know their cholesterol on a full panel during this. But importantly, what we'd like to do is around 6 weeks, we'd like to know that we're winning. The reason being that then we'll have time to increase the dose after that. I mentioned AGP a few times. This is the study that shows that treated cats, and I have to say these cats were not treated with BOVA legal drugs. These cats have been treated with drugs that are currently illegal for the use in the UK. But what they have done is taken this group of cats and they've shown that returning the AGP becoming normal was good sign. It was a good sign. It predicted cats that recovered, and it normalized before globulins. This study also measured serology, just to reiterate that it was rubbish at monitoring. I'm going to have IDEX and whoever else kind of beating my door down, aren't I? But it proved that monitoring serology was not helpful. It's not the disease. So what if they don't respond or they relapse? Well, I always say to people, if they don't respond, are you sure about your diagnosis? Have we missed something? And I think that's really important, to revisit your workup and sometimes rescan them and things like this. But if we are confident, then we will increase our doses, and ideally by 5 mg per kg per day. Some cats we get away with 3 mg per kg per day. Look at how they're giving it. Are they getting it into the cat? Are they fasting it before, as we said, and just giving it in a tiny treat? And we could consider adding a drug called mefloquine, which I'll tell you in a moment. And we don't really know whether interferon and a drug called polypropanol immunostimulant are useful or not. If they relapse at the end of the course or afterwards, then they need another 12 weeks of treatment, which you can imagine is very, very expensive. But there are cats, and in Australia these drugs are a bit cheaper, that have been treated twice and they've then been disease-free for many, many months. So it's possible that you would need to do that. And what you could do in that situation is just use the oral medication. So it's all evolving, but I want you to be sure, if you're using these drugs, that you inform the owners really well of what we're talking about. Because we're learning about these terms. We use these terms about relapse, remission, cure, and it really reminds me of lymphoma treatment. And it's because we don't really know whether these cats are cured completely. But what I can tell you is that the followed up cats from 2020, are now quite far out, over a year from their treatment, and they don't show sign of relapse. Can they get FIP twice? We don't know the answer to that. What I will say is that earlier treatment is better, and cats that are less ill are better. So what we don't want is a cat like this, which is an obtunded cat presenting with FIP and being hypotensive and really, really sick. And the data from our firms that those cats don't do as well. Just be clear with your owners about your expectations and that we're learning about these drugs. What about when do we stop treatment? And that actually is proving quite a challenging question. And here's Leo again. I'm going to show you his bloods to show you why it's challenging. This is Leo at the end of his treatment. So he's done 12 weeks of initially remdesivir and then GS, but he still has a mildly elevated globulin. And these cats are really difficult because we don't know what to do with them. ALT increases are very common with these drugs, so we're not worried about that. I'm worried about this. His AGP, so our usual recommendation is to then measure AGP. His AGP was normal. What do I do with that information? I think probably we can stop treatment. Here's another one. This would be another classic at the end of the treatment with a very mildly elevated globulin. What I usually say is, well, let's look for other evidence of active disease. So let's recheck imaging. Is there any fluid? Let's recheck lymph nodes. Another funny group are these cats where their neurosigns improve, but they don't resolve. And in those cases, what we tell people to do is look at the stability of those signs, because I think there's some scarring of the spinal cord in the brain. So they may have a persistent ataxia, but is it worsening? Is it getting better? Is it the same? So there's things that we need to look at about stopping treatment and things that we don't fully understand. I would say that the majority of cats that have mildly elevated globulins at the end of treatment, but a normal AGP and no other sign of disease, when we stop treatment, they don't relapse, but we don't know that for sure. What about adverse effects? Well, painful. Remdesivir is painful to inject. There's no getting around that. And some cats feel a bit poorly afterwards. Apparently humans do too with COVID. There's a few things that you can do to try and help your clients, with new needles using gabapentin or buprenorphine before. And as we said, we can get a worsening hyperglobulinemia, and actually pleural effusions can get worse initially as well, but don't despair. And I mentioned that we see sometimes some abnormalities on bloods, and what we see are high eosinophils. This is Hudson developing an eosinophilia, and we can see lymphocytosis. We don't really know what these mean and why it happens, but they tend to resolve once we stop the treatment. ALT elevations are common, as we said. In the odd case, they're up to 400 or so, but most of them are around 150. We're not seeing any renal sort of things. Some people measure SDMA. It seems to be variable, but we're not seeing cats develop kidney injury as a result of these drugs. Okay, so just shows you. This is a cat called Millie who came in a taxi every day to her vets for 84 days to have her injections. The owner was disabled. So owners show you such dedication to their cats. What you're probably also thinking is, what the hell do I do if they don't have any money? And that's really difficult. And it's not, we shouldn't feel bad about euthanizing those cats. These drugs are very expensive. And so if they are so cost limited, using a few weeks of these drugs, I think, is almost more unfair to the patient and the client. What we can do is make sure that we're not marking up the drugs too much and making sure we don't monitor them too much. We monitor their weight and we monitor them clinically. You can even measure their abdomen with a tape measure as a very crude measure of effusion. So adapt it. And then we wonder if there are some other drugs that might be useful. And owners need to understand these limitations, and not, as we had one owner asking for a refund at the end of the course when the cat was not successfully treated. I mentioned this drug a couple of times, so just to finish, I want to mention these other drugs. Mefloquine is a cheap, old-fashioned drug used for malaria, and there's a couple of studies showing that it has effects against coronavirus. Some people don't think it's very effective, but we have used it in some cases where we've felt it's what we call got them over the line, like it's kind of when they've got some persistent changes, we're on the highest dose of GS. Has it made the difference? Leo went on to mefloquine at the end of his course of GS when we had those elevations in globulin. So we're not really sure, but it's certainly something to think about adding. And then, as I mentioned, these kind of immunostimulant drugs make sense because the immune system of these cats is so messed up, particularly if they're really sick. So Danielle Gilmore, for example, thinks there may be some benefit of using interferon or PPI in combination with the antivirals, but nothing's been studied. This is an interesting drug. This is another human antiviral drug, which is currently in the form of that trade name, I don't know how you say it, Lagavrio, is restricted for human use. There is an illegal form called Hero Plus, which you could buy from China. So clients may do that, and I need to make you aware of that. But it's possible that this drug would be very useful, and the Australians can now get this legally. So watch this space, because I think we might see some use of this drug, or in combination, or in neuro cases, or really sick cases. That's what they do in you and I with viruses, use combo treatment. So what do we do with Hudson? I told you I gave him some injections of remdesivir initially. The other reason I did that was to get him feeling better and his appetite up. If I sent him home with those tablets in that state, that owner would have despaired. So I kept him in for 2 days, gave him injectable remdesivir, and then we discharged him. Now, he was a cat where we increased the dose of treatment because he had some persistent changes on his bloods and he just wasn't doing quite as well as I wanted him to. So we did increase his dose and he did very, very well. It was him doing that licking, but can you see him here terrorizing the room as a British Shorthair should when he came to see me? Oops, got my volume here. Here he is. He's eating his food. And here's his bloods. So at 30 days, his globulins had normalized, his bilirubin had normalized. He did show some adverse effects. So he had an eosinophilia, however we want to interpret that. But you can see a massive improvement. And here he is. So you can understand why it's a very satisfying disease to treat now. So thank you very much for listening, and I'm very happy to take any questions.
Okay, Sam, thank you so much for that journey through FIP.
Sorry, it's a bit of a grueling journey. You see, I didn't want to cut anything out, Lisa, you see.
No, it has been absolutely fascinating, and I'm so pleased that we were able to go on that journey with you, and also with Hudson and with Archie and Oscar and Leo as well. So thank you for sharing all of it with us. It has been fascinating, and I've got my kind of pages of notes here of what you've been saying. So your enthusiasm comes off you in waves, and it's just been so lovely to benefit from your experience, both, you know, from the cases that you have seen day to day in practice, and also from the FIP advice line as well. So you've been in contact with cases from literally all over the world and benefited from that experience as well. So thank you for sharing it with us. I know it's an incredibly complex subject, and I don't work in practice anymore, but when I did, you know, it's massively frustrating. But back in the day, like you know, under here there are lots of grey hairs, so you know, cats that didn't make it through were the order of the day. So now, having seen that the treatments and what we can do for them is so encouraging. So thank you for that. Just to touch on a point that you made about the diagnostics, and obviously HORIBA have a vested interest. We chose Sam as a completely independent speaker. We do produce an instrument which will run PCR testing on feline coronavirus and a lot of other things. However, whilst we mention it, you know, that's the word from the sponsors. Diagnosis of FIP is a very complex subject and multifactorial. So I think there's no easy answer to diagnosis, and there's no one particular test, and that's really been demonstrated to us today. So I think that using the whole package of tools at your disposal is the best approach, and also the FIP advice line is there obviously as a great resource, and take advantage of the experience of Sam and her colleagues that are there to help you out with these cases. So
yeah, I must say, you know, it's not just me. There's Emmy Barker, Sev Tasker, Steph Sorrell, and we all kind of take it in turns answering questions. So I'm very grateful to them as well. And yeah, I mean, absolutely, I'm completely independent to the point where I had to ask you, Lisa, didn't I, what PCRs you guys did? So it shows that I wasn't biased in any way. And I think you're right. I think PCR has an absolute place in the diagnosis of, and a very important place in the diagnosis of FIP. I think what we want to do is people to just use it, you know, use it in the right way and on the right samples. But absolutely, very useful test. But like you rightly said, there's not one test and one bit of paper, is there? It's those, you know, those bricks and puzzle pieces, really.
Exactly, and there are so many different parts of the puzzle, and they often, it looks like change shape as you're trying to put them together as well. So being able to take advantage of your expertise is absolutely brilliant. We have had some questions come in already, as I suspected there would be, despite your very, very comprehensive talk. there are always those cases where there's a particular challenge and things that you want to know more about. So if you do have a question, please feel free to pop it in the question box on the screen there, and we'll make a start with those. So I'm just going to read them off the screen, Sam, just to give you the heads up. So our first question says, in your experience, have you seen that insurance companies are happy to cover the cost of FIP treatments?
Yeah, it's an excellent question, actually. It's a really good question. And we were really nervous about this to begin with. And we had questions from insurance companies, you know, what the heck is this treatment that we're trying to claim for? But I'm pleased to say that they have been covering it. So we haven't had issues from those initial questions. What we've had the odd issue with is cats that have been previously tested for coronavirus on fecal samples and been positive, and then years later developed FIP. And this makes me kind of mad because, you know, if you test my cat, it probably have coronavirus in the feces. I still want, you know, that doesn't have any bearing to the development of FIP months later and things, and that's where it can get a little bit complex. But the answer is the insurance companies have been paying for these drugs, absolutely. And if they refuse, you know, absolutely send them our way and we'll you know, we'll ask, you know, we'll you know, discuss it with them. And we're hoping to publish our paper soon, which is another thing to wave at them, kind of thing, of proving that it works.
Okay, that's a great answer, thank you. And I know this will be the kind of $64,000 question. You did touch on some costs, but what might an owner be looking at once you've achieved a diagnosis? What is the treatment outcome cost likely to be?
So what we initially discussed with people was not putting 100% markup on it, to be blunt, because we know that we obviously and quite reasonably do that with a lot of drugs. But this is one of those drugs where if you do that, you'll make it cost prohibitive, and then the cat is not alive anymore, which is no good for anyone's profits. If we're being, you know, sort of really, really blunt about it, it's in our interest to obviously, you know, have these cats with theirs. And so we were very fortunate within, at that time, CVS and then Linnaeus at sort of limiting their markup at about 20%. We've had people that have managed to persuade their bosses to mark it up a bit less than that, which is brilliant. And some of them are 25%, things like that. So first thing is look at the markup, because if we apply a standard 100% markup, it's going to be, you know, lots and lots of money. I think that even with a limited markup and limited workup, you know, we have to talk about 4,000. We have to talk about 4,000 to 6,000 for kind of more straightforward cases. We've had some sick cases that have required chest drainage, you know, things like this that have been eye-watering, you know, to be blunt, and have been up at the 15,000 type levels. But I think for most of your clients, what we say to people, and actually I think Bova can send you this, is a calculation, you know, so they can, I think Bova have got a form where, you know, it literally says kind of 12 weeks at this dose costs this, 12 weeks at this dose costs this. So I think just being really upfront with your clients and saying, you know, this is an expensive drug, and doing that maths, because if you have a neuro case, obviously neuro cases need a higher dose, and so they're going to be more expensive. So I mean, yeah, I wish it was 200 quid, I really do. And I think this is where we get a problem with some of the illegal drugs, because I have to tell your audience that if they, you know, if they do Google, they may find cheaper sources of drugs that someone sends them in a unlabeled pot in the post. But it's not, I know I see you sort of flinch, Lisa, and it is that kind of thing. But we've got to be, you know, be realistic. And so I would be open with your clients and say, the reason we're recommending this is because it's been quality tested. It has what it says on the, you know, is the drug, and also I can help you if you use this drug. Whereas if they use the other drugs, we can't help them, because that's against, you know, what's illegal for us to do that. Yeah. So I think you've got to be upfront. It's not cheap. I wish I could tell you it was, but do the maths. You know, do the maths. And what some people do, and owners are happy to do, is say, you know, let's do 2 weeks of treatment, and if we're not winning, we'll stop, and perhaps that cat's one of the harder ones to treat. But if we, you know, if we are winning, and often these cats do so well that clients, you know, will find that bit more money to finish the course. But it's a fair question. All I can tell you is we're working hard on trying to get costs down. Yeah.
Of course, yeah, and I think that's a real common sense approach. You know, once you have an idea of costs, you know, it's not cast in stone. And then also you may have further investigative costs as well, we know that, but then at least you can have an open and honest conversation with the clients and manage their expectations. I love the point that you made about a client asking for a refund because there wasn't a fix, you know, and you kind of understand where they're coming from, but it doesn't work like that. We all know that. So I think that very honest approach to start with and knowing what you're up against enables you to manage your own expectations and those of the client as well. So thanks for your input on that, Sam. That's much appreciated. So next question.
And we've got an owner sheet. Sorry, I'm interrupting you, Lisa, but there is on that International Cat Care, they can download a sheet for owners as well, which will answer a lot of questions that are difficult to answer. So everyone in practice is very time poor. You can direct them there and they can have a read as well.
Fantastic. No, that's part of my summary actually, was to remind people of all the fantastic resources that you have pointed us towards, you know, your dosage guides, etc., for people to be able to refer back to. So you've provided a wealth of resources that I think everybody will find useful. So our next query is, do you think it's worth advising potential owners of cats, e.g. those interested in getting a British Shorthair kitten, to ask breeders whether they have had any issues with FIP?
Oh, that's a good question. There's some evidence that there might be a genetic component to it. You know, obviously that's not a no-brainer because we see it in particular, you know, purebred cats and breeds, and it perhaps is a genetic issue. I think that a sensible breeder, if they have had a lot of FIP developed down one line, would be sensible not to breed from, you know, from there. But it is also a spontaneous event. I think as cat owners are aware that my cat could develop FIP tomorrow, and actually I have a very lovely feline specialist colleague and her cat got FIP and thankfully has been treated. But, you know, it is one of those, you know, I try to explain to owners, it's one of those things, we can't prevent this happening. It's a reasonable question, you know, have they had multiple cases, because it may suggest that those lines are more susceptible. At the moment, we don't have a kind of genetic test for susceptibility because it's too many factors involved. So I think it's a fair enough question to ask. Whether you'll get an honest answer depends on the breeder. But I think if they'd had one case of FIP, I wouldn't kind of condemn them on that in many ways, because it can develop at you know, in these groups of cats. It's a very good question that I probably don't have a perfect answer to. I think it's something to be aware of, yeah, definitely. Some very diligent breeders, you get in this whole sort of absolute nightmare of fecal testing for coronavirus, as you can imagine, is a can of worms if breeders do that, because they're likely to have positive results. But what do you do then? You know, now we've got kittens that we will sell that we've got positive results for, and they may never develop FIP in all their life. So it's really difficult, and it's a really good question. I think ask the question, have an open discussion. If they hide it, you know, if they seem shifty about it, then obviously that would make us wary anyway. Good breeders of these type of purebred cats, you know, they know that their breeds are more predisposed to it, and a good breeder would, you know, would be well informed about these type of things.
Okay, thank you, Sam. And I think you said, you know, right at the very beginning as well, that over representation from pedigree cats is seen in the cases that you're coming across. So your British Shorthairs, you mentioned, I think, Orientals as well, Persians too.
Yeah, Maine Coons. It probably represents popularity as well, but certainly I haven't done the stats on it yet, but it will probably come out about 60% purebreeds, 70% maybe purebreeds. So, but that may reflect Maine Coons are a lot more popular than they used to be, and Bengals are actually less popular than they used to be. So it may, a bit like Labradors get everything, you know, but they're the really popular breeds. But I mean, the research would suggest that those Burmans, Ragdolls are another one. The RVC think that Ragdolls do a bit worse. They're harder to treat. They've seen a group of ragdolls with very challenging to treat FIP. I wouldn't say we've seen some ragdolls that have been easy to treat. It's quite variable. That's what I have learned from the data. Yeah, it's quite variable. Some cats do well on a lower dose. Some cats are very difficult to treat. But yeah, those posh cats, definitely. But I don't know if that just, is a popularity kind of thing. But definitely, I keep writing British Shorthair on my big sheet of data, certainly.
And I guess we're learning all the time as well. With every new case that comes along, you're adding to the data, and that's helping us to learn more as we go forwards. Another question that's come in, and if there are any more, please pop them in the Q&A box. We've got Sam. I know we've gone slightly over time. We were planning on finishing at about 9 o'clock.
My fault, Lisa. Blame me. Blame me.
No blame at all. No, I'm absolutely thrilled that we've got such engagement, and it just goes to show that your enthusiasm, can't be curbed for the subject. So we are happy Sam's happy to answer more questions as they come in. So apologies if this seems obvious, says our asker. How would you run an albumin globulin in-house? The practices I work in use Abaxis biochemistry machines. So would you be dispensing a sample of exudate into the cassette and running it just as you would a blood sample?
Yes, I can't comment on particular machines because I'm no expert on those, but it is, as simple as that. It might be worth having a word with the manufacturer, but certainly in our in-house machines, we can do it as simply as that. Just run the fluid through the biochem machine on the on the same slides, run an albumin and run a globulin. You can also actually, if we sort of divert, you can, if you thought you had a ruptured bladder, you can run a urea and creatinine in that way as well. So you can run other fluids through the machine. You probably ought to check with the manufacturer in case they phone me tomorrow and the machine's blown up when it had the fluid go through it, shouldn't I, Lisa? Lisa may know more. You have machines, don't you, for biochem? But I think maybe have a chat with them, but certainly on our machines at Lumbury we could run it run it through, and same I've locum at a few other places and we've been able to just kind of run it through. You can measure bilirubin as well if you think you have ruptures and things like that. So yeah, I think the answer is yes, but don't blame me.
Yeah, certainly on the machines that I have experience on, which is with sales of diagnostics. So the clinical chemistry machines that I have worked with, yes, you can put other fluids through, or of course you can send it off to your reference laboratory as well, just to ensure that you've enlightened them as to what kind of sample you're sending them. And a bit of history is always helpful for it as well, because their pathologists there can often suggest extra things for you. It's nice to be able to work with them, and they find these cases interesting as well. So to answer that question, to the best of our knowledge between us, yes, most machines will allow you to run an AG ratio in-house using your standard test process. But I think, as Sam quite rightly says, if you want to be absolutely sure on that, then just check with either your rep from your lab company or call up the manufacturer, and they'll be able to help you with that. Okay, I think that's all the questions we've got on the list so far. So if there is anything else that anybody wants to know about a case that they have seen, about diagnosis, about treatment, we've seen there's a range of treatments available, and how to do that properly. And also the range of doses was interesting as well, Sam, and a really good point about monitoring the weight, that when these cats get better, you have to be quite careful about ensuring that your dose goes up with the body weight of the cat.
Absolutely. I mean, they can get, you imagine your sort of 14-week-old Maine Coon is going to gain a ton of weight in 3 months, and that can drop their mg per kg dose right down. So we've had some where we've had oh, this cat's just not responding, it's not doing very well, and you've sort of said, can you recalculate the mg per kg? Oh my god, it's gone down to 5 mg per kg, and that's why it's made such a difference. And luckily with that GS, you can quarter, they go into quarters, they're sort of scored, so you can do kind of small adjustments really, but I would urge you to be bold with the increases. Sadly, it just makes it more expensive. But yeah, you're right, just monitor their weight. And actually weight is really good to monitor in cats anyway as a sign of illness, because we know they don't show us things, but they will show us on the scales. So yeah, these people are spending so much money on this therapy. I think just get a set of scales and then they can monitor. But remember, if they're effusive, if they've got effusions, they will lose a bit of weight potentially initially, while they're, so sometimes you sort of hold your nerve a bit because their abdomens kind of go down, and some of these cats could have 500 ml, even more fluid in there, so that's going to go down, but then you want it to be going up.
Absolutely, and we saw with your international kitten, didn't we, just how much fluid can come off and what a difference that will make, especially as a proportion of their body weight. But nice at these simple things. And also just going back to Hudson, his demeanour as well, you know, some of the more subtle things that his owner picked up on, his voice had changed, and you said about his ear position as well. So all of those things that we've taken into account.
Yeah, we've had discussions actually about how painful are FIP cats. Are they painful? And I think some of them, he definitely showed signs of pain. And I wonder if you have a big lymph node and you have fluid, everything's stretched, and that must be painful, mustn't it? And in fact, people, if they have big lymph nodes in their abdomen, they're quite painful. So I think probably loads of these cats we should up their analgesia as well. You know, I do think.
And touching on that, are there any interactions with other drugs that any clinicians might need to be wary of?
Not that we're aware of, and certainly in humans, remdesivir has been sadly used a lot in COVID, you know, with all manner of other drugs. So no, but we're finding out things all the time. But we haven't seen any problems. And actually, lots of these cats are on quite a lot of drugs when they start, because they're sick. So they're on meropitant, they're on mirtazapine, you know, they're on sometimes steroids and things like this, and we haven't seen interaction. The only thing we would say is probably wean down the steroids as you start these drugs. That's probably the only one that I would try to get rid of if possible. But some really sick cases do need a bit of steroid at the beginning, perhaps. But their immune systems are really trash, so it's, you know, we've got to be careful with that, with how much steroid we use.
Of course. Okay, well, thank you for that. There's no more questions have come in so far, so thank you to everybody that's shown an interest and has submitted questions for Sam, and thank you for your very comprehensive answers as well. If there are any questions that spring to mind after the event, you have our contact details for the HORIBA team on the screen, and also, Sam, would you just remind us where vets and clinic staff can contact you for expert advice, please?
Yeah, it's just FIPadvice@gmail.com. So dead easy, FIPadvice@gmail.com, and that will be answered by, you know, us little group of people. And yeah, we're pretty good between us at trying to answer relatively quickly.
Okay, that's amazing. Thank you very much indeed for that, and I hope that everybody this evening who's been able to join us has found it as useful as I have. So just to sign off, thank you to everybody who's joined us, taken the time this evening. Huge thanks to Sam for her enthusiasm, her brilliant presentation, and her question and answers as well. And also a quick thank you to my behind the scenes colleagues at HORIBA, who go to putting these events together and making sure that everything runs smoothly. So we don't have any further events planned for the rest of this year. We just got London Vet Show out of the way last week. I know that Sam was speaking there as well. And we had our stand there, and I understand that there were over 5,000 people in attendance. So
it was nice. Busy. It was really busy. Yeah.
It really felt busy, didn't it, compared to what we've seen over the last year and, you know, the 2 years prior. So no more events coming up, but we'll be back in 2023 with some more webinars and some more commercial events. Again, if you have any questions or any feedback for us, please feel free to get in touch. And if you would like any more news or updates from HORIBA, you'll be offered the opportunity to remain on our mailing list for future webinars, or see our content on Twitter and on LinkedIn for any news or updates that are available there. So if there are any subjects that you would like us to cover in relation to diagnostics in the future, obviously we link these things to our products, but we do use completely independent speakers. We like to have an expert on hand who's passionate about their subject, which is what we've had this evening. Our previous content has been on subjects as diverse as raw feeding, haematology, and hypocalcemia in dairy cattle. So there's been a few different things so far, and we will hope to get just as much engagement from our audience in the future. So a final thank you to Sam and to everybody for joining us, and have a good evening. Thanks very much. Bye.